Good morning, good afternoon, everybody. I hope the holidays were good for you. And if it wasn't, I hope you found one thing that was positive out of it that you can take with you to finish out the year and continue into the next year. So today, this holiday season has really taught us about the importance of family, and I wanted to touch base about the family history. So we have a lot of companies that are connecting names and dates, and it's a big business, but it's also providing information for people for whom relatives have been lost. But did you know that the family history is just more than dates? It's more than names. It's more than traditions. You can get critical pieces of information from family histories. It's a vital piece of our medical puzzle. And here's the kicker. Sometimes we can see trends that we haven't really studied or known in our medical textbooks. So the garden variety diseases like diabetes, hypertension, cystic fibrosis, we know about that. But there are some clues and important clues that we can glean from a family history, especially if you're having non-traditional or atypical symptoms, and it's something that has been tracking through the family. So, number one reason why the family history is important is to deliver personalized care. If we see patterns arising from parents, siblings, grandparents, for example, then we can use our medical knowledge to kind of figure out what's going on if it's not typical. If it's something like diabetes and you're pregnant, it can actually help us to assess what your lifetime risk is. If it's just diabetes from the pregnancy, then your overall, and there's no family history, then your overall risk is 50-50. However, if there's a strong influence, particularly of type 2 diabetes, then your lifetime risk goes up to as high as 75%. So a lot of times in a pregnancy, if we can connect family history, then we can educate you and tell you what you need to do after pregnancy to optimize your health, such that when you're further down in your senior years, we can mitigate that surprise. The other reason, number two, for the family history is that there is genetic testing. Now, I'm going to pause for a little bit and talk really briefly about genetic testing. Genetic testing is not like your blood count, where if we want to find out if your blood count is low, we do a test and it tells us that your blood count is low. Genetic testing is often very difficult. It's very complicated. It's not a broad sweep of a test that will zoom in and pinpoint the answer. Sometimes genetic testing can give you other results that may or may not be related to the condition of interest. However, as a clinical geneticist, what I will do is I will do a 3-generation pedigree analysis and then come to a determination of if there's criteria for genetic testing, and B, what testing needs to be done, because that testing needs to be ordered in a specific fashion to ask the specific question. Now, the caveat to that is that if the test is negative, it doesn't exclude the fact that you have disease. It's just saying that the disease of interest, we don't find the most common mutations. So genetic testing has to be done in concert with a family history. It has to be done in concert with whatever is going on, and then we have to determine if there is going to be productivity in doing the genetic testing, because sometimes it can lead to other results that are not anticipated and may not be clinically significant, but it's sure going to cause a whole lot of anxiety. In number 3, determining familial health patterns, we can institute preventative measures. For example, the history of hypertension and diabetes, that's the most common one. We can do preventative measures because we have the nature, which is the genetics, but we also have the nurture, which is how we take care of our bodies. So even though we can't change the genetics, we might be able to alter the environment of what we put in our bodies, how we treat our bodies. Do we, cut down on salt for hypertension? Do we maybe eat less trans fats? Do we exercise for cardiovascular fitness with the nice side effect of weight loss? So, the family history is nothing to be sneezed at. So when you're having that next family meeting and we're talking about Auntie P and Cousin Vi, and, all these stories are coming out, stick a pin and ask a pause. Just say, hey, do you notice any medical conditions that are tracking through that I need to know about? We're having children. We want our children to know their medical history. So don't forget to ask that piece of the puzzle, okay? This is Dr. Heather Stanley-Christian from Unity Maternal Fetal Medicine. You can find us on social media at Unity MFM. Our brick and mortar office is in Claremont, Florida. Our webpage is unitymfm.com. We want to walk into the new year with at least one different mindset, okay? I'm doing it. I would love for you guys to join me on the journey. And I'll see you next week. Don't forget to breathe. Walk good.